Hi, I'm Rob Cushman, the Medical Officer of Health for the Renfrew County and District Health Unit. A year ago, this message would have been filled with optimism, with vaccines arriving. But no, Omicron has taken us by storm. And now we have a shortage of vaccines when everyone's looking for boosters, not enough appointments at our clinics, even our registration system crashed. We don't have enough tests, and we're having trouble doing contact tracing. And we're very worried about hospital beds and the surge. In fact, that's why all these additional measures have been taken, and that's why the government has decided to clamp down preceding the New Year's Eve festivities. So it's not a happy situation. I'm here to really talk to you about healthcare workers. Cases have grown exponentially, and we're really worried about whether or not our hospitals can cope. Will there be enough beds? Will we have enough ICU capacity? Well, you know what? It's really not the physical capacity that's the biggest challenge. It's the workforce. Healthcare workers are burnt out, they're brittle, and we're seeing many more cases amongst them now. They're getting it at work, they're getting it from their families, and they're getting it in the community. So we may well be in a situation where we don't have enough healthcare workers. And this is a sorry state. And yet we have an all hands on deck situation where healthcare workers are doing everything they can to keep working. And yet at the same time, there's a lot of frustration out there amongst the public. And some people think they have a right to take out their anger on healthcare workers. And these are for things that are not within the control of the healthcare workers. Does a receptionist who's been scorned by someone visiting a vaccination clinic have any control over the appointment bookings? Does a nurse who's been vaccinating for the past year have any control over the fact that we're trying to vaccinate to give boosters to all of those over the age of 18 in a very quick and short time frame? No, not at all. And is it the health unit's fault that we don't have enough antigen tests, or that we have problems with PCR tests and can't test everybody? No, but some people think it's their right. Now, healthcare workers are burnt out, they're overworked, they're brittle, and you know what? A lot of them are really having a lot of trouble. We're seeing people leave the healthcare profession in droves, and yet we've seen a dramatic increase in verbal abuse. And this is really, frankly, very harmful and very hurtful. And I think it has to stop. And frankly, I don't think it has to stop. I know it has to stop. So this is a warning. Now, by and large, the public has been very helpful and very supportive. But with the increasing frustration and anger, a certain number of people think they have a right to really vent their anger at healthcare workers. And as I said before, this has to stop. But I would say equally, be very careful, because don't bite the hand that helps you, because down the road, you may need this hand. And in fact, for you or for someone in your family, and it may not be available, because we are losing healthcare workers. They're tired and they're fed up and they're burnt out and they are leaving in droves. So we need your support. Now, it's only a few people, but their impact is enormous. As I said, it's harmful and hurtful, and it's had a dramatic effect on our staff. It doesn't help them when they're working under the most trying circumstances already. So we need your support. And I thank most of the public for their ongoing support. Keep it up. But for those of you who are angry and frustrated, I understand who's more angry and frustrated than us, the healthcare workers, but please stop it. It's hurtful, it's harmful, and it may end up, as I said before, hurting you in the end. We all need to be in this together. Each and every one must do their part. Kindness and respect are as much a part of the battle against COVID as vaccinations and the adherence to public health measures. Thank you.